Welcome back once again to the CERCA Expert Talk for the month of August. As we all know, air pollution is an emerging public health concern as there is a growing evidence that the poor quality of air adversely affects human health due to the presence of various toxic pollutants. Moreover, linking air pollution from its source to adverse human health effects is a complicated phenomenon that requires a multidisciplinary approach for better understanding. Decision makers need relevant, comprehensive estimates of the disease burden attributable to different risk factors. Now, public policy is a key strategy for improving air quality and people's air pollution related health. While public policy remains a key strategy for reducing air pollution, individual actions can also play a vital and a complementary role in placing the individuals in control to reduce their exposure to air pollution. Policy measures designed to reduce emissions, improve ambient air, and consequently reduce health impacts can be effective, but are generally slow to generate change. India's NCAP program, the National Clean Air Program, which was launched in 2019, aims to improve air quality by integrating a lot of actions spanning science, technology, policy, and education, both at the city and the state and the regional level, and also aim to achieve a 30 to 40% reduction in pollutant concentration. NCAP strategies, they aim to be very comprehensive, aiming to facilitate funding, technology, as well as attention to improved air pollution management at the state and city level, and also support a range of actions aimed at implementation and scaling of clean air solutions. Importantly, improving public awareness of the health risks of air pollution is among the NCAP strategies aimed at strengthening the case for accelerated implementation of clean air solutions. However, the progress is slow, since the root causes of India's continuing air pollution problems are very complex. We are very pleased to have with us today Dr. Pallavi Pant from the Health Effects Institute, USA, who would be speaking on assessing India's progress in tackling air pollution, perspectives from science, policy, and public engagement. Now, this interactive talk will offer insights into India's journey towards cleaner air through collaborative efforts in science, policy, and public engagement, and opportunities for action towards cleaner air and improved health in India. Dr. Pallavi Pant is the head of global health at the Health Effects Institute, USA. She has more than a decade of experience in research and public engagement on air pollution, particularly in low and middle income countries. Her research has focused on urban air quality, including source apportionment and exposure monitoring and assessment. She also has extensive science communication experience. She serves on the governing board for OpenAQ and holds editorial roles on journals including PLOS Global Health and Journal of Exposure Science and Environmental Epidemiology. Dr. Pant holds a master's in environmental sciences from the Terry School of Advanced Studies, India, and a PhD in environmental health from the University of Birmingham, UK. Now, this talk would be of 30 to 35 minutes duration, followed by a 10 and 15 minutes of question and answer session. On behalf of CERCA, I once again welcome you, Dr. Pallavi, for sparing time for this talk. I now invite you to carry this session forward and deliver your talk. Over to you, Dr. Pallavi.
Thank you so much, Hemant, and I'll actually start by thanking you for giving me this, time and opportunity to talk to all of you a little bit about air pollution. And you sort of laid it really well that we need time to make progress. We cannot expect results to come through, in a day. So I wanted to take a look back and see how and where we've made progress and who has been involved in that progress that we've been making on the issue of air pollution over time. Before I get started, I just wanted to confirm that you can see my slides.
Yes, we can see.
Okay, perfect. Great. So yeah, over the next 30 minutes or so, I wanted to take a step back in time and look at some of the ways in which the air pollution conversation in India, the progress that we have made, in the areas where we have made progress, how has that happened? And how have science and policy and also the civic engagement or public engagement played a role in it? So first things first, I think, this is a webinar series which continuously talks about pollution in its various forms and also talks about air pollution specifically. This is not an issue that we as India have been dealing with alone. Countries around the world, including many which are now considered very clean, including the US and UK, or I would say relatively clean because there's still progress to be made, have taken decades to try and get to this stage. They started with polluted air, especially, if you've been familiar with some of the air pollution narratives, then you might know about the London smog incident that happened in the 50s in the UK and sort of spurred action, which then led to cleaner air over time. So the reason I'm mentioning this is that India's problem of air pollution is not unique. Many countries around the world have sort of gone through similar trajectories, have dealt with similar questions and similar problems. And second, there is reason for hope because countries have been able to clean up the air. There is blue skies on almost a daily basis in many countries as a result of action. And India too will get there. It might take us time, but we will get there. Having said that, across India, air pollution is a problem. And especially, I want to mention this because a lot of times we think about Delhi as the place that has air pollution issues, especially during winter months. And it's in the news, it's something we talk about. But as the last few years have shown, there are many cities and states and villages around the country that are getting impacted by air pollution. Mumbai was in the news for having really bad air quality a few months ago. So we see that this is not an issue that one city, one state is dealing with alone. This is an issue that is relevant to the entire country and especially relevant to the states in northern India, the ones that form the part of the Indo-Gangetic Plain. The other piece to this is that the issue of air pollution in India, like in many other countries, is linked very closely to energy. As you can imagine, in order to produce energy, we need to burn fuels. That's sort of been the norm for many decades and centuries almost now. And India is no exception. We have been using a variety of fuels, including fossil fuels and increasingly renewable energy sources. But a lot of people in India still do not have access to clean energy sources. So if you look at the map here, the one to my left looks at the PM 2.5 averages across the country. We see this red band in the northern states. Then we also see, some of the central Indian states that have higher levels. And then as we go towards the southern part of the country, we see the levels are a lot lower. Very similar to that map, if we look at the one on the right, that tells us how many people across the different states are using solid fuels like wood and animal dung or maybe coal for cooking at home. And if you notice, a number of states here have more than 60 or 70% of people still using solid fuels for cooking. And what that means is that not only are they getting exposed to air pollution in their homes, it is also leading to and contributing to air pollution outside or outdoors. In fact, multiple studies have now shown that household use of solid fuels is actually one of the biggest sources of ambient or outdoor air pollution in India. And if we are to address the household air pollution problem, we would actually go, far in trying to address India's ambient air pollution problem as well. So this is a pan-India problem, and this is a problem that has a lot of intersections with our energy conversation, access to clean energy, the ability to use clean energy sources, etc. And that's where one of the biggest success stories also lies. So many years ago, in the 80s and the 90s, household air pollution or the use of solid fuels used to be the biggest driver for health impacts, or what I'm referring to as the burden of disease here. But over decades, we have continued to see that as people moved away from more polluting fuels to cleaner fuels, we see this reduction in the health impacts resulting from household air pollution. So that's good news. That means if we continue down that trajectory, if we continue to move people to cleaner energy sources, we are going to see improvements in terms of health outcomes and health impacts for people, including and especially women and children, because women often are the ones that are cooking with these polluting fuels. So they're getting exposed to this air pollution. And children are often, especially younger children, toddlers, are usually near and close to their mothers. So they may also experience higher exposures. So the good story and the good news is we have seen reductions in household air pollution related health impacts. Somewhat troubling news that in that same time frame, we have seen that the number of deaths, the total health impacts related to outdoor air pollution, including fine particulate matter or PM2.5, as well as ozone, which is a gaseous pollutant, has increased. The increase is not as steep as we see the decline for household air pollution, so that's good. But this also means that there is still a lot of work we need to do in order to really get to a place where we have clean air and healthier populations. So I wanted to take, a slightly different approach here. And a lot of times when we're talking about air pollution and who's doing what, we tend to think of very specific buckets of people, right? We think of government because they're making policies, and we think of scientists. Then we think of the civil society groups and the lawyers and all the other people in between. In 2019, Sharad Kutikunda had this really interesting analysis that was based on a book from Malcolm Gladwell. And in that article, Sharad talked about three different types of people that contribute to change making when it comes to air pollution in India. And how he described them is feeders or collectors of information. That would include some of you who are scientists in the audience, people who are trying to understand better why do we have this problem of air pollution? What have other places done to address it? If you change X, does it lead to Y? Essentially gathering and collecting information. A lot of that information can then get utilized by the drummers or the noisemakers. So essentially people who are using and leveraging the information that the feeders are producing, and then they're trying to get that into the hands of as many people as possible. All of that narrative, more science, more information, more evidence, and more people knowing about this information can then lead to the change makers or the decision makers who are ultimately responsible for bringing about change, who are responsible for large level policy making, and who are in the end absorbing a lot of this information and ideas and coming up with solutions. So in case of India, when we start to look at the way in which different types of people have been involved in the air pollution discourse and in the change-making process when it comes to air pollution, we've seen that almost all different groups have been involved. The government, of course, they're the ones who make policy decisions. They're the ones who often provide access to information, which is then utilized for a variety of other purposes. In case of India, another interesting and unique thing is that the judiciary, including our courts, have been very much involved in big changes when it comes to policy. If you recall the CNG switchover that happened in Delhi many years ago now, that was led due to, or that happened due to judicial intervention. And since then, there have been many instances where the judiciary has played a very big role in what the policy making around air pollution is. Similarly, academic and research institutions have a big role to play. They are the ones who are feeding us the information or collecting the information. And then the civil society and the public at large also play a very important role. But in all of this, we almost need a connecting body. And that often is media, which is able to take snippets of different pieces of information, which is taking all of the stories and the data that is coming from different pockets and trying to make sense of it and present it to the people who are reading newspapers or who are watching the news or who are on sort of social media and other digital media platforms. A combination of all of these then also spurs entrepreneurship. In the last 5 to 6 years, we've seen that there has been a rapid increase in new entities that are interested in thinking about air pollution from different perspectives. Some are trying to address it from the point of view of mitigation. Are there tools, technologies that we can come up with that will help reduce people's exposures? There's people on the other side who are saying, can we build better tools to measure air quality and build those tools in a way that is relevant for the Indian conditions and the Indian environment, the pollution levels, etc. So there's a lot of interesting ways in which these different groups of people intersect. And overall, as they intersect more and more, the availability of information and the conversations around air pollution get richer. So we are not just talking about one pathway, we start talking about multiple pathways, as we have seen in the Indian case. And I want to give you one example of that, of how this has happened. So in the last few years, especially since around 2013, 2014, we have seen that there's a lot more data on air quality that is now becoming accessible. And that's happening as a result of a variety of factors. It is the low-cost sensors, which are cheaper, easier to install. People can buy them off the shelf and see what the air quality is in their home, in their office, in their school. There's new models and increasingly more efficient models that are helping us think about air pollution. What is it today? What is it going to be 3 days from now? And then there's satellite data, which is being mined to try and understand how air pollution levels have changed over time. What this does is it increases access to air quality data and air quality information. And that then enables more research. If we have more data, we have more questions that we can ask because now we have the tools and the means to address them. More research then also means that there's more attention to the topic because there's new information that's coming out. And that attention can be very local in a city, in a state, in a country, and it can be international, as it has been in the case of India. We've seen not just the Indian media talk about air pollution in India, but also the international media and international organizations talk about it. Now, as all of this starts happening and people start getting access to more information, there's more research and more information. That also means that the civil society engagement can be more vibrant because now there are data and stories that can be told about air pollution. How it affects people's health? Where is it bad? Where are we making progress? All of those things. So we're going from data to science to stories that are now engaging more and more people. And of course, with social media, which has also become really big in about the same time frame, right? Since early 2000s to now, we've seen more and more things on the social media front. We've seen people becoming more active, more vocal about their thoughts and sharing them with the world. So as people get more information, they get more stories and they add their perspective to it, what they're experiencing, what they're seeing. That starts to build a larger discourse around air pollution, which then means there is more public interest. So there is more policy interest in some cases because there's public demand for change and action. And all of this also goes back to, manufacturing, research and development, entrepreneurship, as I just mentioned, because if a topic is gaining a lot of attention and there is interest and there is funding available, there will also be some bright minds thinking, how do we, do this better? How do we do this as sort of, in terms of technology, in terms of solutions? We've seen that in air quality monitoring. We're seeing a lot of that in the context of agricultural burning also. What are the ways in which we can deploy other tools, other technologies, other solutions so that we don't have to burn agricultural waste and we don't have to experience the air pollution that many parts of Northern India experienced during certain months. So it's a very interesting nexus. And you can take almost any example of big policy change that has happened in India, and you can tie it back to some components of the flow that I talked about here. And the increase in research output is particularly interesting because in the last 20 years, especially, if you look back at how sophisticated the science has become and the types of questions that people are asking that are both trying to address the basic science. So, what do we know about air pollution? What do we know about its sources? There's programs like the NCAP Coalesce. This is not the National Clean Air Program, but a research project which has actually brought together multiple institutions across the country. It's a very, very interesting project which has both generated new science. There have been a variety of research papers, built collaborations across institutions in India, and also trained a lot of the next generation scientists and researchers who are now going to continue doing this. We have seen more applied sciences like the decision support system for air quality management in Delhi, or the air quality forecasting tools that we now have for multiple cities across the country. We have also seen greater information on city level data, city level emissions and sources through programs like UPNA and others. And especially in the wake of the National Clean Air Program, that type of information has become much more common and much more easily accessible. Because we have more data on air quality now, and we have various ways of using it, we're also seeing an increase in the number of health studies, because now we can start to think, what are the different types of health data that are out there that we can apply the air quality data to and start to answer some of the health related questions. So there are studies that are using National Family Health Survey, other types of surveillance data. There are also studies that are trying to collect new primary information in cohorts across the country. And then finally, there are government-led programs like the project called Samir, which CERCA, I think, is also involved in, which are being led by the national government, or other similar programs that are being led by the city governments and state governments, trying to look at the more practical issues, like how do we fix problem X when it comes to air pollution. Data, of course, this, I'm sure you've heard about this from many other people in the series over time, but we've really seen a massive increase in the amount of information that is available on air quality. And that is both from ground monitoring data, so data that we are collecting and compiling, and from satellite-based estimates, and from low-cost sensors. And a lot of this information, a lot of this data is publicly available and accessible, although some challenges remain in accessing some parts of it. Another very interesting development over time has been the types of organizations that have become involved in the air pollution work. I have been doing air quality work for maybe like 12, 13 years now. And in my very early days, when I was still sort of, very young, learning a lot of new things, there were very limited actors. I could basically use two hands to count all the key people that you could think about who were doing, active and sustained air pollution work. But in the years since then, there has been a rapid increase in who is involved and what are they trying to do. So there's this whole variety of ways in which people are engaging in the air pollution conversation, all the way from research to practice to solutions to building and strengthening capacity, whether it's technical capacity to do the work, whether it's capacity in terms of communicating about air pollution. And all of this has been made possible by some expansion in funding that is available for air quality work. And that changes every few years. So we see shifts happen, and it will be interesting to see what the next 5 years look like. But when the National Clean Air Program especially came into play in 2019, it brought in a lot of international development agencies, philanthropies, etc., who started working directly with state governments to try and come up with institutional processes and programs to address air pollution. And there's also, data companies. There are sort of legal entities, really a very broad coalition of organizations and institutions that are thinking about air pollution in many different ways. People are also increasingly thinking about how these different pieces can connect. So you have the air quality data, you have the civil society, which is very interested in what these data can mean, how they can be used to spur further action. There are, government interventions that are happening elsewhere. So how do we start to bring those different pieces together so that there's, useful interventions and the data gets used appropriately for taking policy decisions? And the other very crucial piece, which often we tend to think of as a very separate thing from science, is the public engagement and the civic engagement piece. There have been grassroots movements in the last, again, 7 to 8 years that have started demanding cleaner air, that have started asking questions about, what actions are being taken. There's now doctors and the medical fraternity, the healthcare workers who are actively talking about air pollution, actively engaging in disseminating information about how air pollution affects your health. There are not just national, NGOs or nonprofits. There's now very regional, city-specific, state-specific organizations that are actively working on air pollution all day, every day. And there are some very interesting ways in which air pollution has also been used as a tool to get people's interest, like these billboards that have been set up in many cities in India now. And also, this idea has gone to other countries actually, where you try to grab people's attention by showing them something that is otherwise invisible. So, the lung billboard idea, what happens if you just put a clean filter in the shape of a lung at a busy traffic intersection in an Indian city? It starts to get black. And I can never see, when I'm breathing in the air pollution, what it is doing to my lungs, but I can see what is happening in this billboard on top. People are integrating air pollution into games so that it's not just, we're not just talking about it in serious conversations. We're also trying to integrate it in ways that are more accessible to broader groups of people so children can think about this. And the other very interesting thing, which is sort of more in the pop culture arena, is that there have been memes, stand-ups talking about air pollution. There are songs that now exist addressing air pollution. So it's really gone into many different spaces in the Indians, context. And the discourse is not just Delhi anymore. We've really expanded it to many cities, many states around the country. Another piece, as I mentioned, and a critical piece is media. So we've had, increasing numbers of stories on air pollution, and they're not just happening in English, and they're not just happening in Hindi. You've probably seen many of those headlines, especially in the English media. But now there are news stories in Telugu, there are news stories in Marathi, in Bangla. So, we are really going to the very local scale, thinking about and talking about the problems there. There are also now, specific organizations that are dedicatedly thinking about news and stories related to air pollution, climate, environment. And I'm sorry, the Let Me Breathe logo didn't come out correctly here, but there's, entities like Carbon Copy, there's entities like Let Me Breathe that are actively and constantly bringing stories that relate to air pollution and environment and health into the public spaces. And this can do some very interesting things. So this figure is taken from a report that Vital Strategies did a few years ago. So it is possible that the trend looks different now. But they were interested in how news media talks about air pollution sources when they're writing stories. So we go from 2015 to 2018, and the big red bar you see here is transportation or vehicular emissions. And we see that over time, the narrative is shifting from transportation or vehicles are the biggest source of air pollution to Oh, there's actually a variety of sources. There's power plants and transportation and residential cooking and waste burning. So we see that as you start to hear more about air pollution and you start to integrate new ways in which data is being collected, you can change the perceptions in people's minds about what is driving the pollution and what needs to be done to control it. And again, I just wanted to mention a few, interesting examples of where and how this is happening. So there's now networks that focus on niche things like what can we do in the space of air quality management to help cities? What can we do to generate new knowledge? How can we build technical skills around air pollution in institutions across the country? So it's not just 5 institutions, that have that expertise. How do we expand our advocacy around air pollution, and then how do we really continue to build health evidence and transmit that health evidence to people, and not an unimportant piece, the funding component, which also has played a very important role in enabling a lot of these things to happen, because we need money in order to do any of these interesting things. So very quickly, I talked about how this change can happen. So I wanted to give you 2 examples from Delhi, because that's where we have seen the biggest shifts happen. And this is going to be a little bit dated for some of you perhaps, but in the 90s, there was a report, which at the time was a landmark report from the Center for Science and Environment, that talked about air pollution coming from vehicles and how it was really bad for the environment. It was really bad for health. And there were intermittent steps, and there were steps before this, but essentially there was a whole narrative at the time that air pollution is a problem linked very heavily with transportation, that led to some court cases, which then led to the huge sort of landmark change that happened in Delhi, that public vehicles, including auto rickshaws, buses, had to switch over to CNG, or compressed natural gas. So, going from that data and information to that policy change involved a lot of different actors. It involved scientists and doctors and, civil society groups, the judiciary, and to some extent the media. Similar example, which is more recent, is the smog episodes that happened in Delhi in 2016 and 17. We saw extremely high levels of air pollution, and it was something people could suddenly see outside because it was gray and dark, and you could feel it in your eyes and in your nose. And that led to a lot of different shifts. So we saw the introduction of graded response action plan in Delhi. We saw that power plants were shut down over time, in sort of the aftermath of these big episodes that brought a lot of public scrutiny and both national and international attention to the issue. And then we also saw that that conversation has continued on with other air pollution episodes, and we now have the Commission on Air Quality Management, which is a very unique sort of new governance entity that is trying to think about air pollution in a holistic way. And I've mentioned more data, but let's look at it from the context of what happened in Delhi, because again, it has been the focus of a lot of work over the last couple of decades. So the main things I want to highlight here for you are the increase, or the massive increase, in the number of air quality monitoring stations that the city has seen. We have gone from maybe 1 or 2 functioning air quality monitors to more than 40 functioning monitors in the city. And all of that data is now helping us make decisions about where action needs to happen. If you plot how that has looked for the entire country, we've seen a similar trend, really high numbers of air quality monitors that are continuing to grow across the country in urban environments. So we need a similar push in rural environments, because that's where the air quality is also not that great, especially in the north. And this is something I don't want to dwell on for too long, but there have been a variety of national, policy programs that have happened, including some that are targeted at sectors. So that would include things like the switch to Bharat Stage 6, and then emission norms and the Ujjwala Yojana, and then other interventions that are trying to link people up with LPG. There have been programs like the National Clean Air Program or the Program on Climate Change and Human Health, which are trying to tackle how do we address air pollution in cities and how do we create better information around health and air pollution. And then we've also had some governance related initiatives like the Commission on Air Quality Management. So this is sort of a snapshot of how change has happened, and we could pick any of the examples from what I was just mentioning in the previous slide about National Clean Air Program or the switch to Bharat Stage 6 or the sort of institutionalization of the um, Commission on Air Quality Management. And we will see that in each case, we've had people across the spectrum of leaders and drummers and change makers that have played very different roles at every step of the way. And today, where we are in our fight against air pollution, there is a much broader recognition that air pollution is a problem. There is a very vibrant set of organizations that are thinking about that problem, both from the scientific perspective, but also from the policy perspective and the economic perspective and the public communication and engagement perspective. And also, there are, slowly starting to be signs that in some places we may be heading towards the place where air pollution levels are not increasing or going up, and that they are actually starting to stabilize and in some places go down, which goes back to what I said at the very beginning, right? That change is not going to happen in 1 year or even in 5 years. We really need to think about what the next decade will look like and what is the role that each of us can play in these three buckets. Are we going to be the people that are collecting information, or be the people that are transmitting and translating that information, or are you someone that wants to be where the change happens, where the decisions get made? And there are overlaps in all of these. Personally, I think of myself as sort of somewhat of a collector and somewhat of a drummer, so trying to do those two pieces, what does that look like for you in what you do, and what you're interested in is something that I'll let you think about. And with that, I'll close and happy to take any questions. And thank you again to the CERCA team for giving me this opportunity.
Now, the house is open for question and answers. Thank you, Dr. Pallavi, for a very, very interactive talk. And now we invite the house for any question and answers that you might have.
So we got one question in our chat box, so I'll read it for you. So there's one question on there are ample amount of data on air pollution, but few sources that were discussed, such as cooking fuel, is hard to capture. Is that case? Are there ways to quantify?
Yeah, that is a really good question. And the piece around data on individual sources has definitely been hard over time to capture. And the way that people have addressed that problem is either by using some of the national level, surveys that happen at a regular basis that are sort of designed in a way that we're getting representative samples. So those can sometimes serve as a good place to get data, especially on cooking fuel related issues. Then the other approach that some institutions have tried in recent years is to do targeted surveys in states where you may know that household sort of cooking with solid fuels is a bigger problem. So the Council on Energy, Environment and Water, CEW, they have actually done two series of surveys looking at cooking fuel use and what are households using. There have also been smaller surveys that have been done to try and understand the barriers to access to fuel and what really helps you decide. So that's on the cooking fuel side. Then there's also other types of databases for things like waste or the industrial emissions, which can be utilized if you're trying to understand how those sources intersect. But I would agree that sector specific and source specific information, especially related to emissions, is still not as easy as it can be to facilitate sort of ongoing research.
So our next question is why is the focus always on the surface concentration of criteria pollutants, not as much on emission inventories?
That's a really good question. So when it comes to regulation or governance related to air pollution, the way that that has been set up in India and in pretty much other parts of the world also is that we look at mass concentration. So we're looking at the how many particles are in the air when it comes to PM 2.5, for example, and not necessarily looking at what is being emitted by an individual source, although there are regulations on emissions from sources. So I mentioned the Bharat Stage 6 emission norms for vehicles. That's one example where we focus on direct emissions from a source. There's similar frameworks for diesel generators. There's similar frameworks for industries and power plants as well. But when it comes to regulating air pollution, we tend to focus more on concentrations. And emission inventories actually, as Disha pointed out, have not been something that were a big focus for a long time. People were primarily collecting, filter samples or other types of samples to measure the total particle levels, and then they were using those mass concentrations. But I would say that in the last, I keep saying the last 6, 7 years, because that's really the time when a lot of change has happened. There is now growing interest on emissions inventories, but they are hard to build and they're hard to keep up. There's constantly changes happening. So IIT Bombay has done a series of emissions inventories. The Coalesce project that I talked about has also produced targeted targeted inventories for some sources, and increasingly, especially scientists are starting to use emission inventories to look at pollution levels, what's going to change over time. But the other limiting factor with emission inventories can also be that you may not have the access to really get all the information you need to build one or to use one. And second, a lot of them get used in models, chemical transport models, and the computing capabilities and the number of groups in India that have done that historically was extremely limited. That is changing now. So I expect that in the next 5 to 10 years, we will see a lot more interest in utilizing sort of ground up emissions databases to try and look at pollutant concentrations and sources. And second, that our computing power and the number of institutions across the country that are able to run these types of models will go up. So that will have a positive impact on, let's not just think about the mass concentrations, but let's also start looking at other ways to quantify the pollution.
Thank you, Dr. Pallavi. It seems we don't have any more questions from the participant at this moment. So moving to our vote of thanks part. So I thanks all the participants for your attention during the presentation, and we appreciate Dr. Pallavi for sharing her insights and expertise, shedding light on the critical aspects of science policy and public engagement in addressing air pollution. And thanks for being part of the conversation. So, and I thank all the participants representing from different sectors who took time off for attending this talk and making this session interactive. So, we will announce our next scheduled talk via email and social media handle very soon. Stay tuned for the more impactful events in the future. Thank you.
Thanks, Dr. Pallavi, and thank you everyone for participating in this talk. Thank you very much.
Thank you very much. Thanks a lot.
Thanks.